Welcome back, everybody. Today we're doing a deep dive on something you think you know, but trust me, there's more to this than meets the eye. We're talking about melatonin.
Melatonin.
Yep, and we've gone deep for this one. We've got medical journals, research summaries, we've even got a global perspective for you. And you know what? The stuff we found about what melatonin can really do, well, it's way more than just putting you to sleep.
Oh, absolutely.
Yeah.
It really is. You know, we always sort of pigeonhole melatonin as that sleep hormone,
Mm-hmm.
but that's like, using a Swiss Army knife just for the bottle opener.
Huh, I love that.
Yeah.
Okay, so to get us started, we all know melatonin's a hormone, right?
All right.
It's made in that tiny pine cone-shaped gland in our brains, the pineal
The
gland.
pineal gland. Yeah.
And its main job is running our sleep-wake cycle, our internal clock.
Exactly. When it starts to get dark, your pineal gland starts pumping out the melatonin. And that's how your body knows, okay, it's time to wind down. But then what do? We flip on all the lights, we're staring at our phones and our tablets and our TVs, and that's like sending a big stay awake signal. It's no wonder we have so much trouble with our sleep sometimes.
Yeah, it's like we're tricking our bodies into thinking it's still daytime, even when it's like midnight. But here's something I thought was interesting. As we get older, we naturally make less melatonin. Do you think that's maybe why so many people, as they age, have trouble sleeping?
That's a really great question, and it's definitely something that researchers are really looking into right now. But here's where it gets really fascinating. Melatonin, it does way more than just, help us sleep. It's actually a really potent antioxidant. It's even more potent than vitamin E.
Whoa, really? Antioxidant, like the stuff that fights off, the things that make us age and get sick. But how does that work if it's also the sleep hormone?
So basically, you can think of it this way. Melatonin, it directly goes after those harmful little molecules. They're called free radicals. And those free radicals, they can really damage our cells. They can damage our DNA.
Right.
And, that kind of damage, it's linked to a lot of the major health problems that we see. Heart disease, even cancer.
Oh, wow.
So melatonin, it's kind of like this little warrior.
Yeah.
It's protecting your body.
Right.
But at the cellular level,
Yeah, that's a lot more action-packed than I was picturing. So it's not just about feeling sleepy. It's about keeping our cells healthy, too. I was reading that there's even melatonin inside our cells. Is that true?
you got it. You have melatonin working hard inside your cells, specifically in those energy powerhouses, your mitochondria.
Right, the
And
mitochondria.
protecting your mitochondria, that's
Yeah.
huge. Because when they're not working properly, that can lead to, all sorts of problems, fatigue, brain fog, even more serious conditions, like heart disease, metabolic disorders, even neurodegenerative diseases.
So we've got to keep those little mitochondrial engines running smoothly. And melatonin's like the mechanic, keeping everything in tip-top shape.
Exactly. You got it. And there's actually something that can boost production of this mitochondrial melatonin, near infrared light or NIR.
Or infrared. So that's like heat lamps. Is that right?
You got it. Things like sunlight are fantastic sources of NIR. Also firelight, incandescent light bulbs, even infrared saunas.
So sitting by a fireplace, spending time in the sun, that could actually be boosting this cell-protecting melatonin.
It really is amazing, isn't it? It really highlights how interconnected we are with the natural world. Simple things like sunlight and fire, they can have such a profound impact on our health at a cellular level.
This is blowing my mind. Okay, so we've got melatonin's antioxidant superpowers. It's protecting our cells. Yeah. But I know there's even more to it than that, right? What else does the research say?
Well, studies have shown some really promising results for melatonin in terms of supporting our immune system. And there's even research looking at the possibility that it has anti-cancer properties. And it's also being researched for its potential to reduce inflammation throughout the body.
Hold on, anti-cancer properties, that's incredible. I definitely want to dig deeper into that in a little bit. But first, I have to ask, if melatonin is so amazing, should we all be taking, those supplements?
That's a great question. And it's one we're going to tackle right after this quick break.
Stay with us. All right, so melatonin, pretty amazing stuff, right?
Yeah, definitely a powerhouse.
But what about all those melatonin supplements we see everywhere? Should we all be taking them?
That's a really good question. And it really comes down to you, your individual needs, what's going on with you.
Okay, so who might actually benefit from taking a supplement?
Well, think about those times when your natural sleep-wake cycle is out of whack. Like if you've got jet lag, or maybe you're working the night shift. Even just having, a really inconsistent sleep schedule, all of that can mess with your melatonin production. And in those cases, a supplement might be helpful just to get you back on track.
That makes sense. What about folks dealing with sleep disorders? Oh, like insomnia. I mean, so many people struggle with that.
Yeah, absolutely. And melatonin can be really effective for certain sleep disorders, especially the ones that are tied to your circadian rhythm, like delayed sleep phase syndrome or non-24-hour sleep week disorder.
So it's not just about like falling asleep faster, it's about getting your body's clock back in sync. We were talking earlier about migraines and blood pressure. Are those things that melatonin supplements could potentially help with?
Yeah, there's some promising research out there. More studies are always needed, but some people find that melatonin can really help reduce how often they get migraines and how bad they are. And for blood pressure, there's some evidence that the controlled release form of melatonin, that it might actually help to lower blood pressure.
That's pretty amazing. But I also know that anytime you take something,
Sure.
even if it's natural,
Right.
there's always a chance of side effects. So is melatonin safe?
For most people, melatonin is considered safe, at least for short-term use. Like any supplement, though, it can have side effects. But they're usually pretty mild. Things like headaches, maybe some dizziness, nausea, or you might just feel a little bit groggy the next day.
The dreaded melatonin hangover.
Yeah, exactly.
Definitely not a good feeling. I guess it goes without saying. Probably shouldn't be driving or operating heavy machinery after taking melatonin.
No, absolutely not. You want to be really careful about that. Make sure you're not doing anything that requires you to be really alert after you've taken it. And maybe even more importantly, melatonin can interact with certain medications.
Right, you mentioned that before, so it's really important to talk to your doctor before starting melatonin, especially if you have any health conditions or you're taking any other medications.
Always best to check with your doctor.
Okay, so let's say someone has talked to their doctor and they're good to go with melatonin. What about dosage? It comes in so many different forms, doesn't it? Pills, liquids, even those topical creams I've seen.
Yeah, you're right. Melatonin is available in a lot of different forms. But the oral tablets and capsules, those are probably the most common. The right dosage is going to be different for everybody, though. It depends on the person and why they're taking it. It's always a good idea to start with a low dose and see how you respond.
So again, talk to your doctor. But what if someone wants to try boosting their natural melatonin production, without taking supplements? Are there ways to do that?
Oh, absolutely. It all goes back to what we were discussing earlier about respecting your natural circadian rhythm.
Right, working with our bodies instead of against them?
Exactly.
Yeah.
One of the simplest and most effective ways to increase melatonin naturally is to make sure you're getting enough exposure to daylight during the day.
Okay.
And then in the evening, you want to start dimming the lights, reducing your screen time, at least an hour or two before bed.
So it's about that contrast between light and dark, bright light during the day, then dim and cozy in the evening. What about those blue light blocking glasses everyone's wearing these days? Do those actually do anything?
They can, yeah. Blue light from our phones, our computers, it's really disruptive to melatonin production. So wearing those glasses in the evening, especially if you just can't avoid screens, it can definitely help.
Interesting. I've also heard that certain foods naturally contain melatonin.
Yeah, there are a few. The amounts are usually pretty small, though. Tart cherries are a good example. Walnuts, goji berries, and some types of fish, like salmon and trout. Adding those foods to your diet definitely won't hurt.
Right.
But they're not going to be some miracle cure for low melatonin.
So it's more about an overall healthy diet than relying on specific foods to boost your melatonin.
Exactly. And don't underestimate the power of just relaxing. Taking a warm bath, reading a book, listening to some calming music, all of those things can signal to your body that it's time to wind down and start making that melatonin.
It's amazing that we have so much control over our own melatonin production just by making these little tweaks to our routine.
It really is. It's about listening to your body, working with those natural rhythms, and creating an environment that supports good sleep and well-being.
I don't know about you, but I'm feeling a lot more empowered knowing all this. It's not just about popping a pill, it's about understanding this amazing hormone and making choices that support it.
Couldn't agree more. And speaking of supporting melatonin, there's one more fascinating piece of this puzzle we haven't even talked about yet.
Oh, there's more. Okay, I'm all ears. Okay, so you were saying there's one more fascinating thing about melatonin we haven't even talked about yet. Spill the beans.
Well, we've talked about all the ways we can support melatonin production naturally, right? Like dimming the lights, getting sunlight during the day. But what if I told you there's a way to actually boost the melatonin inside your cells using something called near-infrared light?
Wait, NIR light? We talked about that already. Sunlight, fireplaces, those heat lamps.
Right. But here's the thing. Research is showing that exposure to near-infrared light can actually increase the production of melatonin inside the mitochondria. You know, those little energy factories inside our cells?
Oh, wow. So not just overall melatonin, but specifically the stuff that's working to protect our mitochondria.
Exactly. It's like giving those little powerhouses an extra dose of protection. And remember, we talked about how important those mitochondria are for overall health and energy production.
Right. It's not just about feeling sleepy. It's about preventing serious health issues down the road. So is this as simple as just getting more sunlight?
Well, sunlight is a great source of near-infrared light, for sure. But there are other ways to get it, too. Like infrared saunas have become really popular. And there's some evidence that they could have benefits beyond just relaxation.
Hold on. You're telling me that sweating it out in a sauna could be boosting my cellular melatonin levels?
It's possible. More research is needed, of course.
Okay, that makes sense. So is there any downside to all this melatonin boosting? Could there be too much of a good thing?
That's a smart question. And while melatonin is generally considered safe, especially in the amounts our bodies produce naturally, I think it's always a good idea to be mindful, you know? Like with anything, moderation is key.
Right, listen to your body. And if something doesn't feel right, don't push it.
Exactly. And as we've mentioned before, if you're thinking about taking melatonin supplements, talk to your doctor first, especially if you have any health conditions or you're taking other medications.
Great advice. You know, this whole deep dive has been amazing. I feel like we went from thinking about melatonin as just this sleep aid to recognizing it as this powerful, multifaceted hormone that plays a role in so many aspects of our health.
It really is a fascinating hormone. And I think the big takeaway here is that we have more power than we realize when it comes to influencing our own health, you know,
Yeah, right.
by understanding how things like light, darkness, even the food we eat, impact our melatonin production. We can make choices that support our bodies and optimize our well-being.
It's not just about taking a pill, it's about being proactive.
Exactly. And who knows, maybe that's the real secret to healthy aging, working with our bodies instead of against them.
I love that. Well, I think it's time to wrap up this deep dive. To our listeners, I hope you enjoyed this exploration of melatonin. Remember, sleep on it. Consider what you've learned. And maybe try incorporating some of these tips into your own life. You might just be surprised at the results. Thanks for joining us.